Assalamu alaikum everyone. My name is Mohannad Awwad and I'm a second year medical student studying at King Saud University. And today we'll be discussing the anatomy of the spinal cord. So the objectives of today's lecture are as following. We'll be describing the external and internal anatomy of the spinal cord. We'll be describing the spinal nerves. We'll be defining dermatomes, describing the meninges of the spinal cord. We'll be defining the reflex and reflex arc, and finally we'll be describing the components of the reflex arc. Before we begin talking about the external anatomy of the spinal cord, I'll give you a brief introduction about the spinal cord. So the spinal cord is part of the central nervous system, and it coordinates motor, sensory, and reflex signals. Anatomically, it is located within the vertebral foramen of the spine, and it extends from the bottom of the medulla to the conus medullaris. It occupies the upper two-thirds of the vertebral canal, and it is surrounded by three protective layers of meninges, which are the dura, arachnoid, and pia mater. Blood is supplied to the spinal cord from the branches of the vertebral artery and are drained into the vertebral vein. Internally, the cord can be divided into gray matter centrally and white matter peripherally, unlike the brain, which is vice versa, which means that the brain is divided into white matter centrally and gray matter peripherally. This right here is a picture of Rufus Weaver with a fully dissected nervous system in the 1880s, specifically 1888. This right here is a schematic diagram of the central nervous system and the peripheral nervous system. So first of all, we have the receptors. We have the somatic and we have the visceral sensory receptors. These send signals to the spinal cord, which are then processed in the brain, and then motor signals are sent to either the somatic nervous system or the autonomic nervous system. If they are sent to the somatic nervous system, they are sent to effectors like skeletal muscles. While to the autonomic nervous system, it could be divided into three subgroups: the parasympathetic, the sympathetic, and the enteric nervous system. The enteric nervous system you'll be taking in GI. It has correlation with the GI tract. While the parasympathetic and the sympathetic divisions of the autonomic nervous system, they act on smooth muscles, cardiac muscles, and glands. Now that we've finished the introduction, we're going to be talking about the external anatomy of the spinal cord. So the spinal cord begins superiorly at the foramen magnum in the skull. I'll stop right here and let's think about the word foramen magnum. So we already know that foramen means a hole, and magnum means big. So foramen magnum means that there's a big hole in the skull, and we see it right here clearly. So the spinal cord begins superiorly at the foramen magnum in the skull, where it is continuous with the medulla oblongata of the brainstem. So this right here is the brainstem. It is divided into three different parts: the midbrain, the pons, and the medulla oblongata. The spinal cord is continuous with the medulla oblongata, so it is the continuation of the medulla oblongata inferiorly. The spinal cord terminates inferiorly in adults at the lower border of the first lumbar vertebra, and in children it terminates at the level of the upper border of the third lumbar vertebra. The spinal cord is covered by three layers of protective meninges: the dura mater, which is the most superficial, the arachnoid mater, and the pia mater. These serve a supportive and protective function, as well as the CSF, or the cerebrospinal fluid, which surrounds the spinal cord in the subarachnoid space. The spinal cord is attached to the meninges via the denticulate ligaments, as you see right here. The meninges of the spinal cord have a interesting set of names in Arabic. So the dura mater is called al-Jafiya. The arachnoid matter is called the al-Ankabutiyya, and the pia mater is called al-Hanun. The spinal cord tapers off into the conus medullaris. We're talking about the ending of the spinal cord right here. And from the apex of the spinal cord, a prolongation of the pia mater, named the filum terminale, which we see right here and right here, descends to be attached to the posterior surface of the coccyx. The filum terminale is a non-neuronal cord that helps hold the spinal cord in place, so it anchors the spinal cord in place. The spinal cord gives rise to 31 pairs of spinal nerves. The bundle of nerves extending inferiorly from the conus medullaris surrounds the filum terminale and forms what is called the cauda equina. The cauda equina, or cauda equina, in Latin translate to horse's tail. So this right here is the cauda equina, and we can see here that it resembles or looks like the horse's tail. Now that we finished talking about the external anatomy of the spinal cord, we're going to jump into the internal anatomy of the spinal cord. So a cross-section of the spinal cord looks like this. It is composed of an inner core of gray matter, which is surrounded by an outer covering of white matter. The gray matter of the spinal cord consists of a mixture of nerve cells and their processes, neuroglia, and blood vessels. On the other hand, the white matter of the spinal cord consists of a mixture of nerve fibers, neuroglia, and blood vessels. So the difference between the gray matter and white matter is that the gray matter consists of the nerve cells, while the white matter consists of the nerve fibers. And the nerve fibers are myelinated. They are covered by the myelin sheath, and that's what gives the white matter its white color. The gray matter is an H-shaped pillar with two anterior horns, or ventral horns, two posterior gray horns, one lateral gray commissure which connects the both sides, and then two lateral gray horns which are found in the thoracic and upper lumbar segments. The amount of gray matter found in a segment is related to the amount of muscles that are innervated at that level. So when thinking about it, we will find a greater number or a greater size of gray matter within the cervical and lumbar sacral enlargements. The gray commissure connects the right and left horns of the gray matter. In the center of the gray commissure lies a central canal. The central canal extends the whole length of the spinal cord and is filled with cerebrospinal fluid, or CSF. The central canal is lined by ciliated columnar epithelium, known as the ependyma. Superiorly, the central canal is continuous with the fourth ventricle. And inferiorly, it expands in the conus medullaris, which is the final part of the spinal cord, forming a fusiform terminal ventricle. Just to make things straight, the fusiform, if you remember in MSK, the fusiform muscles looked like this. So this is a fusiform shaped object. In the gray matter of the spinal cord, we have several nuclei. Right now, we're going to be talking about the nuclei that are found in the anterior gray horn. So we're going to divide it into three major groups. We're going to divide it into a medial group, a central group, and a lateral group. So we have medial, central, and lateral. The medial group is present in most segments of the spinal cord. It innervates the skeletal muscles of the neck, trunk, intercostal, and abdominal musculature. The central nuclei is present in the cervical and lumbosacral segments. It is present in C3 to C5, which innervates the diaphragm, and we call it the phrenic nucleus. It is also present from C1 to C6, and it innervates the sternocleidomastoid and trapezius, and we call it the accessory nucleus. And it is also found in L2 to S1. The lateral nucleus, or nuclei, is present in the cervical and lumbosacral enlargements, and it innervates the skeletal muscles of the limbs. The nuclei that are present in the posterior gray horn are divided into four groups: the substantia gelatinosa, the nucleus proprius, the nucleus dorsalis, and the visceral afferent nucleus. The substantia gelatinosa is situated at the apex throughout the length of the cord. It is a continuation of the spinal nucleus of trigeminal nerve rostrally. The substantia gelatinosa receives fibers concerned with pain, temperature, and crude touch. The nucleus proprius, on the other hand, is situated anterior to the substantia gelatinosa throughout the length of the cord. It receives fibers concerned with proprioception, two-point discrimination, and vibration. The nucleus dorsalis is situated at the base of the posterior horn from C8 to L3, and it is associated with proprioceptive endings. The nucleus dorsalis is also called the dorsal nucleus of Clark. Finally, the visceral afferent nucleus is situated lateral to the nucleus dorsalis from T1 to L3, and it is associated with visceral afferent information. Finally, we have nuclei in the lateral gray horns. The nuclei in the lateral gray horns are called the anteromediolateral nucleus. It is present from T1 to L3, which occupies the lateral horn. And the anteromediolateral nucleus is also present from S2 to S4 without occupying a lateral horn. These are cell bodies of preganglionic sympathetic neurons and cell bodies of preganglionic parasympathetic neurons, respectively. So, T1 to L3 are preganglionic sympathetic neurons, while S2 and S4 are preganglionic parasympathetic neurons. So this right here is the substantia gelatinosa. Then we have the nucleus proprius, nucleus dorsalis, and then we have the interomediolateral and interomediomedial nucleus. And these are the nuclei of the anterior horn, which are the medial, central, and lateral groups. As an alternative to the spinal cord nuclei, a scientist named Rohr Rex identified layers, or laminas, within the spinal cord where the cells were grouped according to their structure and function rather than solely on location. This is Rex lamina 1, 2, 3, 4, 5, 6, and then we have 7, 8, 9, 10, and so on. In the white matter of the spinal cord, it can be divided into three different parts: the anterior funiculus, the lateral funiculus, and then the posterior funiculus. And in the white matter, it contains nerve fiber tracts. and they are divided into ascending tracts, descending tracts, and intersegmental tracts. These are the most important ascending and descending white matter tracts. So, the ascending tracts, we have the dorsal column medial lemniscal system, which contains the gracile fasciculus and the cuneate fasciculus. We also have the spinocerebellar tracts, which are the anterior and posterior spinocerebellar. We have the lateral spinothalamic and anterior spinothalamic, and we have the spinal olivary tracts or fibers. The descending, we have the pyramidal, which are the lateral corticospinal and anterior corticospinal tracts. And then we have the extrapyramidal tracts, which are the rubrospinal, reticulospinal, olivospinal, and vestibulospinal. And you'll know throughout this block what each and every tract portrays, and where does it, if it ever decussates, where does it have its order neurons, and more information like that. Each level of the spinal cord has its own set of features, and you need to know these regional differences to be able to differentiate the different levels of the spinal cord. These differences are as following. So in the cervical region, it is oval in shape. In the white matter, we have the fasciculus cuneatus and the fasciculus gracilis present. In the anterior gray horn, we have the medial group of cells for the neck muscles, central group of cells for the accessory nucleus and the phrenic nucleus, and then we have the lateral group of cells for the upper limb muscles. In the posterior gray horn, we have the substantia gelatinosa. We also have the nucleus proprius and the nucleus dorsalis. The nucleus proprius, the substantia gelatinosa, but the nucleus dorsalis is absent, and we do not have any lateral horns. In the thoracic region, its shape is round. The fasciculus cuneatus is found from T1 to T6. The fasciculus gracilis is present. We have the medial group of cells for the trunk muscles, substantia gelatinosa, nucleus proprius, and nucleus dorsalis, as well as the visceral afferent nucleus are all present. And the lateral gray horn is also present, which gives rise to the preganglionic sympathetic fibers. The lumbar cross-section of the spinal cord is round to oval in shape. The fasciculus cuneatus is absent, but the fasciculus gracilis is present. The anterior gray horn contains the medial group of cells for the lower limb muscles and the central group of cells for the lumbosacral nerve. The posterior gray horn contains the substantia gelatinosa, nucleus proprius, and nucleus dorsalis at L1 to L4. The visceral afferent nucleus is also present. The lateral gray horn is present in L1, L2, sometimes L3, and it gives rise to the preganglionic sympathetic fibers. Finally, the sacral region is round in shape. It has a small amount of fasciculus gracilis. The anterior gray horn contains medial group of cells for the lower limb of perineal muscles. The lower limb and the perineal muscles. The posterior gray horn contains the substantia gelatinosa and nucleus proprius, and the lateral gray horn is absent, but we have the group of cells, which is S2 to S4 for the parasympathetic outflow. We know that the parasympathetic outflow is craniosacral, and the sympathetic is thoracolumbar. Now we're going to be talking about the spinal nerves, formation, branches, and distribution. So the spinal nerves, we have 31 pairs of spinal nerves that exit the vertebral column through the intervertebral foramina, which is this one right here. We have 8 cervical pairs of spinal nerves, 12 thoracic, 5 lumbar, 5 coccygeal, 5 sacral, and 1 coccygeal. The spinal nerve arises as anterior and posterior rootlets, as we see it right here. These rootlets then join together, forming the anterior root, which contains the efferent fibers, which are exiting the spinal cord, and the posterior root, which contains the afferent fibers, which are entering the spinal cord. The posterior root has a ganglion, as we see right here, and then these two roots merge, forming the spinal nerve. Finally, the spinal nerve divides into a small posterior ramus, which supplies the muscles and skin of the back, which we see right here, and a large anterior ramus, which supplies the muscles of the anterior lateral body wall, as well as the limbs. The ventral rami of the spinal nerves join to form several plexuses at different levels. So we have a cervical plexus, a brachial plexus, lumbar, sacral, and coccygeal plexus. The cervical plexus is from C1 to C4. The brachial plexus is from C5 to T1, and this is the picture of the brachial plexus. Then we have the lumbar plexus, which is from T12 to L5. The sacral plexus, which is from L4 to S4, and then the coccygeal plexus, which is from the S4 to coccygeal 1 spinal nerve. Dermatomes. The skin is supplied in a segmented manner, as we can see right here. So each area of the skin is supplied by a single spinal nerve, and therefore a single segment of the spinal cord is called a dermatome. So as we see here, T1, the segment of the spinal cord T1, innervates or supplies this portion of the skin. T2, then T3, T4, and so on. While there is some overlap in the general distribution of dermatomes, each individual spinal cord level supplies a distinct zone of skin. Testing the touch or sensory perception in these areas can be used to localize lesions of the spinal cord to a specific cord level or spinal nerve. Now we're going to be discussing the reflex and reflex arc. A reflex may be defined as an involuntary response to a stimulus. So a reflex arc consists of the following anatomical structures. We have somatosensory receptors. Example of that is muscle spindles and Golgi tendon organs, which you'll be discussing in this block in much details. We have afferent nerve fibers, type 1A and type 2. Integrating centers, we have the spinal cord and spinal reflexes. Efferent nerve fibers, we have axons of alpha motor neurons. And then we have effector organs, which are mostly muscles. So in this case right here, the somatosensory receptor receives the hammer being struck right here. It sends it through afferent nerve fibers to the spinal cord, which it is integrated, and then efferent nerve fibers send it to an effector, which then leads to the leg being pushed up. The reflex arc of spinal reflexes does not involve the brain or the brain stem. It is completely dealt in the spinal cord. However, upper motor neurons may modify the intensity of the reflex response. Deep tendon reflexes are monosynaptic and are clinically important. So let's take the knee reflex or the patellar knee reflex. The muscle that is tested is the quadriceps muscles, and the spinal level that is tested is the L3, L4 spinal level. And same goes to any other reflexes in this chart. At the end, one of the most important references that you guys might need in CNS is Snell's Clinical Neuroanatomy. It is an amazing reference that you can use in CNS, and it'll help you understand the neuroanatomy in much details. Another reference that I used for this lecture is Snell's Clinical Anatomy by Regions and Netter's Atlas of the Human Body. Some recommended channels. In CNS, Dr. Najib's lectures are amazing. You have Medicosis Perfectionalis as well, Ninja Nerd, Armando Hasdungen, Rhesus Medicine, and Noted Anatomist. That is the end of this lecture. I hope that you benefited from the lecture. This was Mohannad Awwad, a second year medical student, and thank you for your time.